Hello, this is Dr. David Green, CEO of the Washington Pain Network. The topic today is what are the available knee injections for arthritis? Over 40 million Americans suffer from arthritis. It's the leading cause of disability in the United States. More women than men suffer from arthritis by about 20%, and the total arthritis costs for treatment exceed $100 billion a year. In the first decade, 2010, of the 21st century, the number of knee replacements in the U.S. doubled. I can tell you pretty confidently that the population of the U.S. did not double in that time period. Almost 600,000 knee replacements are performed every year, and by 2030, demand could reach 3.5 million every year. 35% of those who get a knee replacement are between the ages of 50 and 69. A knee replacement is a quality of life procedure. It's elective and should only be performed after considerable conservative treatments, which can consist of nonsteroidal anti-inflammatories, Tylenol, prescription pain medications, topical pain medications, physical therapy, or bracing. When it comes to the injections, there are several different types. The gold standard for many years now has been cortisone, which is steroid and can help relieve the inflammation and pain from arthritis. Hyaluronic acid involves basically the motor oil of the joint. We have natural hyaluronic acid anyway in the joint, so these injections have sort of come on strong in the last 10-15 years. And the latest is regenerative medicine injections. This includes platelet-rich plasma, bone marrow aspirate or fat-derived aspirate stem cells, and then amniotic-derived stem cell injections. Since the 1950s, steroid injections have been a mainstay of knee arthritis treatment. Initially, they were performed for rheumatoid arthritis. A few decades later, it spanned over into osteoarthritis. They don't cure anything. They're not going to help spur new cartilage to form. And it's questionable if they actually harm cartilage. Initial animal studies in small animals showed they did harm cartilage. Follow-up studies in larger animals showed they didn't harm cartilage, and there's actually been no animal studies to show that they harm cartilage, so it's a little bit of a debate. Studies show 75% good to excellent results with cortisone injections. Pain relief may last for months at a time, and for decades they've been the gold standard for the treatment of knee arthritis non-operatively. Hyaluronic acid injections were FDA approved in 1997. They're made from rooster combs, and it's called viscosupplementation. There's numerous trade names now available. The most common are Synvisc, Hyalgan, and Orthovisc. None of these products have shown superiority over one of the others. One of the largest studies in the U.S. showed beneficial effects in 80% of patients for over 6 months with hyaluronic acid injections. That was into the knee. And the theory is that you provide this lubrication, anti-inflammation, and that the theory is compels more cartilage to form. That's not been definitively shown, but it's such a low-risk procedure that it's very popular nowadays. PRP therapy is called platelet-rich plasma therapy. It involves a simple blood draw from the patient of between 30 and 60 cc's. The blood's put into a centrifuge and spun rapidly for 8 to 15 minutes. You end up with one of these layers that's used. It has concentrated platelets and growth factors. 1 to 3 injections is placed into the painful knee. Multiple studies have shown significant pain relief. One out of Hospital for Special Surgery showed 70% good to excellent results at 6 months with just one injection. And then it also showed preservation of cartilage in 70% at 1 year. So just one injection worked wonders for 7 out of 10 patients. In the knee, there's also studies for other joints as well. Now, stem cell injections have the potential to alter the course of arthritis and not just to mask pain. That's what regenerative medicine does, is regenerate tissue as opposed to just a steroid, which is a proverbial Band-Aid for pain relief. Now, there are bone marrow-derived stem cell injections, fat-derived stem cell injections, amniotic-derived stem cell injections, which are obtained from women who undergo a cesarean section, scheduled, and they donate their amniotic fluid. It's put through an FDA-regulated lab, and it has an amazing amount of stem cells, growth factors, hyaluronic acid, anti-inflammatory. It's non-steroidal. It's been used over 20,000 times in this country, and it's worked extremely well. Mesenchymal stem cells, these are not embryonic. There's no fetal tissue used. There's no ethical concerns with the amniotic tissue. Stem cell injections for knee cartilage defects. There's a study that showed 6 months after transplantation, patients' clinical symptoms had improved, and the improvements have been maintained between 17 and 27 months, so over 2 years' worth of excellent results. There are no large clinical studies in humans to prove efficacy, but there are a lot of small studies. The bottom line is that there are various types of knee injections available. All are low risk and outpatient. In combination with other treatments that were mentioned earlier, cane, bracing, physical therapy, they may help delay or avoid the need for knee replacement, and all these procedures can be repeated every 3 to 6 months as needed. The top non-operative pain management is through the Washington Pain Network. There's multiple clinics throughout the state accepting over 50 insurances with over 25 treatment options available for all types of pain conditions. Success rates are over 90% on average with the board-certified award-winning doctors. Visit us online at washingtonpainnetwork.com and then call us for more information and scheduling at 877-877-8556. I'm Dr. David Green with the Washington Pain Network. Your pain stops here.